David Boris, and I'm a small businessman in the 10th Congressional District. And we were just up in Mark Kirk's office speaking to him about the principles for healthcare for America now. Trying to understand whether or not Mark understands how difficult it is out there for small businesses to keep up with the astronomically rising costs of healthcare, how difficult it is for my employees to be able to keep up with year-over-year double-digit increases in their contribution rates, and whether or not Mark understands that we realize, and he should too, that we have finally come to a point where the unfettered free market system of allowing for-profit private health insurance companies to magically find solutions that they've been unable to find for this market for a decade or a score or more of years has to end, and that we finally need a significant government involvement, probably to the point of a government-sponsored plan that would be available to people who feel that they can't get the proper coverage in the private insurance marketplace.
My name is Dan Sherry. I own Kennedy's Creative Awards in Waukegan and the ID store in Barrington. My story is a few years ago we missed a health payment after 20 years of paying into the system. The insurance company decided that we were no longer welcome. I had unfortunately gone to a doctor just not long before that and found out I had high cholesterol, so I'm now uninsurable.
Yep. My name is Jeremy Bernstein. I work for Working Families Win, which is a partner perspective of special needs, both as a special ed teacher and somebody that takes medication for attention deficit disorder, and the cost and the inability to get insurance if it's a pre-existing condition.
Hi, I'm Kathy O'Brien. I'm a healthcare consultant who has spent the last 20 years working with hospitals and doctors trying to get the bills paid because the insurance companies have spent so much time working very hard not to pay the claims. And I brought that story to Mark Kirk's aide today, and I felt that she was receptive, although I think that she was very young and wasn't really aware of all of the issues that are involved in healthcare. She seemed to be receptive, that she would take this information back to Mark Kirk, and I think that it's up to us to pressure Mark Kirk and all the representatives on these issues and make them understand how important it is that we need to have a universal health care that is not spending 23% of our health care dollars on administrative costs.
I'm Hal Snyder. I'm an MD and an activist for Physicians for a National Health Program, as well as an organizer for Working Families Win. I think it was a productive initial dialogue, and we spoke with a representative of Congressman Kirk, who was very receptive to our ideas and said she will get back to us with detailed responses to our questions on where Mark Kirk stands and what measures he will promote.
We're hoping, and what we've asked for, is that he sign on to our principles, as the candidate opposing him in this race has already signed on. So we'll see what happens.